To the cloud. Yes, we're on. So, good morning, ladies. I was actually supposed to do a live stream last night, but by the time I got done with my radio show last night, it was late, and I didn't think anybody was going to be up at that hour when I got done the radio show. So, what I decided to do was to shoot you a pre recorded explaining your process of the procedures that you have undergone and give you an explanation of what massage therapy is as far as your cosmetic procedures that you have gotten done. So let's start with this. I'm gonna see if I can share my screen with you and you have a better idea of, if you hear any talking, it's my students in the back, my massage therapy students. So here we go, explanation of the process for pre and post-op therapy, massage therapy services. And let's start off with pre-massage therapy. Why should you get therapeutic massages before surgery? And this is why. Pre-massage therapy services increases the immune system and actually prepares the body for what it is about to go through, so that your immune system or your cells that are involved can increase your downtime when you are going through the stages of healing. And keep this in mind, your immune system is for your immunity as far as infections. The whole purpose of our immune system is to fight off infections and stuff like that. Also, to assist your body with the healing time, which I have already mentioned. Next is the purpose of post-op surgical massage therapy services. Cosmetic surgeons highly recommend that you get post-op massage therapy services, and the people that you should be getting them with because of your procedures is licensed massage therapists that is certified in post-op care for cosmetic procedures. Okay? So assist the body in healing time and return the body to its optimal health. And of course, prevent edema, enhance what the cosmetic surgeon has sculpted, reduce swelling, inflammation, and prevent fibrosis. Also, when you return to the whole goal of this, ladies, is to get you to return to your normal activities of daily living, which reduces your downtime from your cosmetic procedures. And next is the next purpose is, we as licensed massage therapists that is certified in post-op surgical care for cosmetic procedures or medical procedures, because I'm certified in both. There are medical protocols for post-op cosmetic surgeries that we must follow. Manual lymphatic drainage or manual lymphatic drainage massage. However, there's a difference. The manual lymphatic drainage is done by what we call lymphedema therapists, but also by massage therapists that have had the proper training in manual lymphatic drainage. So, manual lymphatic drainage, I'm gonna try to give you a visual. Manual lymphatic drainage is not supposed to be any type of deep pressure to where it's going to cause you more discomfort than what you already in. It is a light service because the lymph nodes are very superficial. The lymph nodes are not deep. Okay, so if you ever been to a massage therapist and she says, okay, I can do manual lymphatic drainage or manual lymphatic drainage massage on you, and when you left that massage therapist, you may have felt like she didn't do nothing. And I have seen ladies say that. I have seen the text messages that say that they went to a massage therapist and they felt like, oh, she didn't do anything. Well, if she did manual lymphatic drainage, non-invasively, or she did manual lymphatic drainage massage. It was light because of the location of where the lymph nodes are located throughout the entire body, ladies. The lymph nodes is very, very superficial. There's no need to go deep. Purpose: to drain the fluids towards the lymph nodes, and you have three mother nodes, and they are supraclavicular, axillary, and in the groin area. So for the ladies that receive liposuction and Brazilian butt lift, naturally, even though we have lymph nodes throughout our entire body, your main mother nodes, meaning your main lymph nodes, is going to be here, supraclavicular, axillary here, and in the crease of the panty line, which is your groin lymph nodes. Next is fibrosis treatment, and that is to break up any fibrosis or hardness that you may have. Scar tissue release. The scar tissue release is to minimize, eliminate, or decrease. And I'm gonna also add this in here. It was something else that I wanted to mention with, seroma. If your massage therapist tell you that you have, or she feel as though that you have seroma development, she may refer you to your primary care physician or to the ER. I'm going to tell you about a client of mine who didn't do what she was supposed to do when she was supposed to do it. So she comes to see me, and in the beginning she was doing fine, but she skipped some massage therapy treatments. That's one thing that you don't want to do, ladies. Don't cheat your body. You made an investment, follow that investment all the way through. Don't cheat yourself when it comes to these massages. So she skipped some services. And after about 3 weeks, she returned back to me because I reached out to her to find out how she was doing. And when I reached out to her, I found out that she was hospitalized. And the reason why she was hospitalized is because when I saw her last, I told her that she had seroma development and she needed to see the PCP, her primary care physician, or go to the ER. She did not. Ladies, she did not go, and she ended up in the hospital for 2 weeks. What they did, because you would think that they would just reopen up the incisions and drain it out. As a licensed massage therapist, by law, I cannot reopen incisions to drain the fluid out. And any massage therapist, whether they are licensed or not, unless they are dual status, they should not be reopening your drainage points to release the fluid. So anyway, what the hospital did, in the hospital, to me, they can open up the drains because all the people, all the personnel, all the healthcare professionals and healthcare providers that are licensed to do that could have easily opened up her incision points and drained the fluid out. They didn't do that because her body became toxic from the seroma development because she waited too late. She didn't go when I told her right away. She waited, and they put her on antibiotics, kept her in the hospital for 2 weeks. So ladies, if your massage therapist told you that you have seroma development and she suggests that you see your primary care physician, or she suggests that you go to the ER, please take care of that right away. However, you may also run into a massage therapist that say, okay, I'm a drain it. Find out if they are dual status, meaning they have the credentials to actually do the drainage. Okay? Not unless she's a nurse and a massage therapist. But if she's just a massage therapist, you want to know, can she be right in her scope of practice of doing it as a licensed professional? So that's what I wanted to share about that. Now let's talk about scar tissue, and tissue repair. A scar is formed during your healing phase as your body produces collagen fibers to close and heal the incision or the wound. The three phases for wound or incision healing. If you see me looking up, that's because I have to watch my students while I'm doing this video. So you have the inflammatory phase. During the inflammatory phase, you have blood clotting and the blood clotting begins and the incision or the wound will sometimes, well, not sometimes, but it will look red and inflamed. This is going to be for a few days. That's the inflammatory phase. So look at it this way. From the time you get off from the time that you get off of your surgeon's table, the inflammatory phase kicking in, okay? Next is the proliferation phase. This is when new collagen and tissue starts to form. This is the collagen formation form. And what happens here is the collagen fiber forms to close and adhere to the incision or the wound. In your case, it would be the incision. In this stage, you may have it takes some time. You want to have a raised scar. This can take anywhere from 3 to 10 days in the proliferation phase. Next is the, ladies, a little bit. Next is the remodeling phase. This is the final and last stage of tissue healing. And here your scar tissue forms, your nerves are healed. And I put this in here because when I say your nerves are healed, think about this. When the surgeon gets done and you off the table, we call something that's desensitized because you can't feel the area where the surgeon was at. So during the remodeling phase here, let me highlight this. During the remodeling phase, I gotta highlight it right. Okay, during the remodeling phase, your nerves begin to heal and you begin to feel the areas where the massage therapist is actually servicing you. Your feeling starts to return to the area and the scar tissue feels less textured. So it's sort of like smooths out a little bit in the remodeling phase. So these are the three phases that I really needed y'all to understand, because when I read the post about the ladies thinking or believing that massage therapy shapes the body, there's one modality that does that as far as massage therapy without any tools and with just the use of the hands. And that modality is called lipomassage. That is a non-invasive manual body contouring modality that is done by trained and skilled lipotherapists. They have been certified to do lipomassage. So, and that should not be done in your phase 1 of post-op care. That should be done in the maintenance phases, which is phase 2 and phase 3 of your post-op care. So I just wanted to put that out there so y'all have an understanding, because we're definitely going to get to where the body contour actually starts. Okay. Next, I want to talk about garments. Now, compression garments should be worn after your procedures. They are worn to promote healing time and to help the skin and muscles adhere to your new body contoured shape. Compression garments reduces bruising and swelling by promoting consistent fluid and distribution. Reduce the risk of infection by keeping the surgical site sterile. Promote quicker healing and reduce incidence of hematomas and seromas by increasing blood circulation. Promote proper and even skin adhesions. Also keep this in mind. You have some surgeons who do not recommend the garments, and these surgeons have their own reason. And one of those reasons very well may be, because I want y'all to think about this. Once I tell you this, I'm gonna tell you about another alternative. Up to you if you choose it. So, um, when you put on your compression garments, even though your garments is to enhance what the cosmetic surgeon has sculpted you, okay, is to promote healing. But also, when you put on your compression garments, it's also displacing your internal organs. They are not going to be they're going to be in the same place, but it squeezes them. It squeezes them because remember, you're putting on this compression garment and it's tight. So just think about, what are you doing to your internal organs as you put on this compression garment and leave it on for hours. So you have cosmetic surgeons who are for compression garments, and you have cosmetic surgeons who are not for compression garments. However, that decision rests with you. Next, I'm going to tell you about a client that I had who did try the compression garments, and the compression garment caused her to have a lot of bruises. And the bruises she had on her body was from underneath the breast all the way down to her ankles. And she's just one of those women who can't wear compression garments. And what she wore, and I know some of y'all is gonna like, I don't want to wear that. That's fine. What she wore was the full body spandex. That it's flexible. It contoured to the shape that the cosmetic surgeon gave her, and that's what worked for her. I'm only saying this because the spandex full garment is an alternative. Some of you ladies may know about it, some of you ladies may not know about it. I'm just sharing the information for what worked for one lady or other ladies. It may or may not work for you. Just try it, because I've also seen where compression garments have caused one a 1 inch to 1.5 indentation in the mid back area of where the board was. And because y'all have to put on the foam, put on the board, put this on, and then you put the compression garment on, like all that is squeezing into the skin. I'm just saying, giving you some information of what I see in my private practice and alternatives that other women that I have serviced have used. Okay, just some information. That's all I'm providing here. Moving on with garments, what is the length of time required to wear compression garments? Well, lovelies, it depends on the type of procedure and how the plastic surgeon seals your incisions. Next question is how often should compression garments be worn? Some say 2 to 6 weeks. However, the norm is longer than 2 to 6 weeks. Some of you women, y'all come out of it at 6 weeks. The majority of women stay in your compression garments a whole lot longer than 6 weeks, at least up to 4, 5, 6 months. It's up to you. The key with garments, and I put this down here so y'all can see it, compression garments that do not fit properly can do more harm than good and increase one's chances of seromas, uneven skin composition, scarring, tissue necrosis, which means dead tissue, and it becomes dark and black and looks dead. So ladies, make it a priority that your garments are measured and fitting properly, because this right here is the second reason why some cosmetic surgeons is not pro garment. Okay, just some information that I'm giving out. Next is a recap. Post-op surgical care massage therapy services. Who recommends post-op surgery care? Cosmetic surgeons. Why are they recommending it? To assist your body in the healing time so that you have less downtime. How is that done? That is done through a licensed massage therapist that is certified and have had proper training in the cosmetic procedures that you have had done to your body, which means they have had the proper training for post-op surgical care for cosmetic procedures. And there's other cosmetic procedures that women are getting done. It just so happened that liposuction and Brazilian butt lift is at the top of the demand list, thanks to you ladies and the cosmetic surgeons. What is done? Medical protocols is done as it pertains to your procedures, and manual lymphatic drainage is done as it pertains to your procedures. Phases of recovery time. I'm going to say this. In your phase 1 of recovery time, you should be receiving these. Not a machine, just these. That massage therapist is most effective with these than a machine. Next is, ladies, you should not be put on a carboxy machine in phase 1 of post-op. I'm going to say this again. You should not be put on a carboxy machine in phase 1 of post-op. The carboxy machine can cause fibrosis. That's why. Next is, you really should not be put on any machine right out of post-op. Let the massage therapist do what she is trained to do, and that is to help you and assist you in getting your tissues back to their optimal health. That's the goal in the first phase of post-op. First phase of post-op, ladies, is all about tissue healing. And as the massage therapist is doing what she's supposed to do, she is also enhancing what the cosmetic surgeon has already done, which is giving you a sculpted contour that you wanted and paid for. And that's your investment. Goal and purpose. The goal of the first phase of post-op, tissue healing. That's the goal of the first phase of post-op, is tissue healing and restoring the tissues back to their normal, getting your nerve endings to come back from being desensitized. So that's phase 1. Phase 2 and phase 3 of post-op is all about contouring and maintenance. Body contouring meaning enhancing what the cosmetic surgeon has done. Maintenance meaning instead of you coming in 2-3 times a week, when you get to the maintenance phase, you may be coming once a week, depending on the restoration of your tissues. Next is, here we go. When you get to the maintenance phase of post-op recovery, here are your options, ladies. So the answer, the statement that I saw, or the question that I saw in the group, here is your answer, but I had to give you all of this before I gave you what this is. So here are your options in your maintenance phase of post-op. You have liposage. Liposage is a non-invasive body contouring modality that is done by licensed massage therapists that have been to an advanced class called liposage. I am a liposage trainer, and I have trained many women and guys in liposage. Now, when it comes to liposage, guys can do liposage because one of the area that's being serviced manually, unlike post-op. And I'm gonna get into that in a minute about male male licensed massage therapists doing post-op. There's something that I want to share with you ladies definitely about that. Your other options is cavitation, radio frequency, and vacuum therapy. Wood therapy is definitely wood therapy, cavitation, radio frequency, vacuum therapy contour body ice, sculpture, cool sculpt, herbal body wraps, fashion plastic. All these are actually non-invasive manual body contouring modalities and techniques that you ladies, post-op ladies, have the option to get these services when you get to your second and third phase of post-op care. And lastly, okay, let me finish this and then I'm gonna move on to the other thing that I need y'all input on. I like to take the time out to say thank you for everyone that watches this explanation of the process for pre and post-op care. And I like to take the time out to say thank you for sharing it. Please share it because it is information that you ladies can definitely use. And it's just giving you some information and educating you on what to expect during the process. So ladies, the key points here is it is 98% up to you in maintaining the new body that you have, that your cosmetic surgeon has sculpted for you, and which is your investment. 98% of that is up to you. And it's not just the surgery that was done. You ladies still have to do some things to maintain that new body. One is nutrition. I'm keeping it real with you ladies. You have to have a nutritional lifestyle change so that you do not end up back on the surgeon's table for the same procedures. Physical fitness as it pertains to your procedures. You got a new booty, you need to be working that new booty out. And I believe at 8 weeks post-op, you should be with a personal trainer or in a fitness center getting the booty worked out. If you don't want to do that, then you need to do these at home. You could do lunges at home. You can do squats at home. Of course, when your surgeon says that you can do it, but the average time is after 8 weeks, you can do those exercises. Then there is us, licensed massage therapists and or body contour practitioners. Now, I'm going to say this. There's a lot of individuals out there that are not licensed massage therapists, let alone massage therapists or in the healthcare industry at all. And they are doing post-op care. Not taking anything away from them because their work is awesome. Their work is good. However, they're not licensed professionals. And did they have the training in servicing post-op care ladies, or did they go on YouTube, which I call YouTube University, or did they go on Instagram University and watch somebody that was doing and say, oh, I can do that. Go figure, ladies. You hire who you want to hire to receive your services. Next is the body contour practitioners. Now, the body contour practitioners, they may or may not be licensed massage therapists or massage therapists, because to do manual body contouring, such as these services here, I'm gonna take you back a minute, such as these services here, you are not required to be a licensed massage therapist. A person can just get the training in these modalities and get certified as a manual body contouring practitioner. Just these services. Now, for this one, hold on, for this one, this is a required modality, and it is done by licensed massage therapists who have been certified in lipomassage only. Okay, so that's what I wanted to share with you. Now, I want to I'm gonna tell you. I'm gonna tell you what I did, and then I want your feedback. I put out a post about, I'm gonna say 8, 9 months ago. And in that post, I did state who should be doing post-op services and who should not be doing post-op care. And the reason why I did that is because there's a lot of ladies across the country that are sustaining injuries from people who have not been properly trained or who are not massage therapists at all. That was the purpose of the post. In addition to that, in that post, I did state that I would not certify any male. Hold on, I'm flashing. Hot flashes, y'all. Hot flashes when you get my age. I did state in the video that I would not be certifying any male massage therapists, and here's why. Because of the nature of what it is that we do as licensed massage therapists servicing women who have had these procedures. A lot of times, you ladies are naked. You are. And I can't see certifying a male massage therapist and his mind is not going to wander and he keeps it professional. That's what I had put. Then I spoke with one of my male colleagues and he brought up some very good points that I couldn't even argue with as far as males in healthcare doing things I feel like females should be done. But one of the things that he mentioned as a male massage therapist, he does breast massage. I don't know why, but he does. And he also said that I was being discriminatory because I made the statement that I would not certify male massage therapists based on the nature of what it is we do with you ladies. And he also told me that I was being judgmental. So he suggested that I put a poll out in the field. I did that. And I'm not going to say what city, what state that the massage therapists, mainly the female massage therapists, they like really dug into me. And I had to fire back. Yes, I did. I had to fire back and let these female massage therapists know exactly what it is that we do with you ladies because they was being judgmental on me. So once I explained to them about what it is we do with you ladies in post-op care, they sort of understood. But massage therapists, and I could be wrong for what I'm about to say, but if I am, it's okay. I'm all right with that. Massage therapists in the industry is inside a box. The services that you ladies is receiving is both. It's in the spa industry because it's cosmetic, but it's also in the massage therapy industry because the cosmetic surgeons have made it that way. You ladies have put the demand in place. You ladies demand it. The cosmetic surgeon demands it. Licensed massage therapists that see the need in helping you is answering the call. However, you have massage therapists who's in a box. They don't see outside the box. And that's how come these massage therapists was like sort of judging me, sort of attacking me. So this is what I got. I did have some male massage therapists that said absolutely not. They're not interested in learning how to do post-op care because they understand the nature of what it is that we do and that you ladies, 10 times out of 10, you're naked. And then I had one, actually two male massage therapists. One said he doesn't mind learning something new. Another one said that he would want to learn. But the majority of the male massage therapists said no. So I'm asking you ladies, you're the ladies that getting the cosmetic work done by the surgeons. You're the ladies that have set the stage. You're the ladies that are getting the services done. So my question for you is this. What would you prefer? Here are your options. Would you prefer a female massage therapist serving you in post-op care that has been trained in post-op care? Or would you prefer a male massage therapist, licensed massage therapist that has taken the training, proper training, or it doesn't matter to you? Those are the three options I'm going to put out there. 1, female, 2, male, 3, doesn't matter. So if you ladies would be so kind, can you please give me your input, because this makes a difference of who is servicing you and who you are comfortable with servicing you. What this is what I want y'all to do in order to get your feedback, because I'm gonna post this in 2 places. I'm gonna post it in a group, but I'm also going to post it on my primary Facebook page. If you share the video, and I would appreciate if you ladies would share the video so I can get all reach as many ladies as I can and get the feedback from you ladies on how you feel. If you ladies say female, then it's going to be female. If you ladies say, oh, I wouldn't mind a male servicing me, that's your call. And that means I got work to do. That means I have to start training and certifying some licensed male massage therapists, because for anybody who takes my course, it's going to count where it's needed most. And the massage therapists know exactly what I'm talking about. So I'm going to end this here, and I will be checking. And let me stop my share now that we have finished it. So ladies, I want to say thank you for taking out the time. And thank you, class. Say hello, class.
Hi. Hi, hello.
Hello. They're studying for their state license exam and doing a business project. So ladies, thank you for taking the time out to watch this video. I hope that it has explained a lot of stuff that you ladies had questions with, or you wasn't sure about something. So that's my time, and have a great Monday. Enjoy your week. Share the video. If you have any questions for me, you could type it in the comments, or you could reach out to me at 267-864-8639, or you can DM me on my Instagram at Philly Timeout Spa. Thank you. Take care, everybody. Have a blessed week. Bye-bye.